kind of bringing us to the paper and this idea of looking at thyroid hormone withdrawal versus recombinant human TSH. And it's interesting that recombinant human TSH is not approved in the US at the FDA, in the European Society that does these approvals. And I think a lot of it may just be this is a small group of patients. It's almost impossible to really do prospective studies and get this data prospectively. And I think they don't have the data to approve it. And yet, you presented in your paper, including your paper, there were 9 studies where recombinant human TSH was utilized in the radioactive iodine treatment of patients with distant metastatic disease. And I think what your study shows, the fact that the thyroid hormone withdrawal were these patients who had these really long follow-up, because your study started in 2006 when recombinant human TSH wasn't even available. So the early patients were the ones going through thyroid hormone withdrawal.
Yes,
and I would
exactly.
assume that the more recent the patients that you've been treating more recently, that you're using recombinant human TSH in the treatment. And I think the study indicates, and your study indicates, and what we, is that this actually, I think has become the norm in a lot of ways, even though it's, I guess, theoretically being done as an off-label treatment. But I think, the feeling is, again, these are sick patients. It's much easier tolerated to do the treatments with recombinant human TSH. There theoretically would be less side effects. You showed some maybe improvement in bone marrow parameters with recombinant human TSH, not really differences in sialadenitis, but I think certainly from a quality of life standpoint, much better in doing treatments with recombinant human TSH as opposed to thyroid hormone withdrawal.